Hi, this is Dr. Sean over at Natural Body Works. Today we're going to talk about considerations for dry needling. Dry needling is a little bit different than acupuncture, which you've heard from me before about acupuncture. We're using the 5-element theory here and talk about the different meridian points, which sometimes for something like your liver or for your heart or for other parts of your body, you may have points up on your hand or you may have points in your face or on your feet. Well, dry needling is a little bit different. Not only do we use different needles, we use a different technique, and we go directly for the heart of a muscle spasm. That's really what dry needling is for. So if you've got chronically tight shoulders, back, hamstrings, knees, calves, feet, arms, wrists, anything like that, we can use this one here is these are called filiform needles. I don't know if you can see this, but it's a very thin needle. This is pretty long, and there's the end of it right here, and there's the other end. You've got the handle right here and the shaft of the needle. Very nice sharp point. They come with a guide tube, which looks kind of like this right here. Make sure you can see that right there. And there's, let's see, can you see the needle on the base of my hand? Yeah, you see a little bit. I can show you how shiny that is. These are very, very thin ones here. These ones are about 0.25 millimeter. That's very thin. 0.3 millimeter is what we use for the dry needling, and that's a little bit thicker, and that's one of these right here. You can even see how thick that is comparatively. We use again the same guide tube. This one's about 3 inches long here, so we can go in about that deep depending on where the muscle is and how we want to get to it. We first of all use hand pressure, and we want to use our palpation skills to find the actual muscle fiber. Sometimes it could be as small as this, like very about an inch long, maybe a 1/4 inch wide. And we want to get that needle directly on the spot. So we'd line the needle up inside that guide tube, right on, say, that muscle, if it was right here. We'd guide it in either perpendicularly or at an angle, depending on which part of the muscle we want to get and how we want to get it. So once we deliver the needle in there, we can move the needle in and out to try to find what we call a twitch response. Now the muscle will twitch, it'll sometimes tighten up. We can also get what's called dai chi. That's that feeling of the muscle or feeling of heaviness or achiness or almost like a liquidy or energetic feel or some kind of like throbbing feel. That's a great sign. We don't really want the pinchy feel, the pokiness of the needle. That goes without saying, but we're trying to get away from that. We're actually trying to get what's called dai chi. Once we get the spasm or that dai chi and we get the little tiny twitch, we can then either move the needle in and out or twist it. Now if we look again at our dry needling needle, we see that this one has this very small little end here, which you can see as we turn it. Very circular little end. So I can turn that needle as it's inside the body. We can turn it this way. And one of the things that happens is that wraps the muscle fibers right around the needle. When it wraps them around the needle, they tend to want to fight that, and they'll try to basically unspasm. Why do they unspasm? Or why do they stop spasming, I guess we should say. The reason they stop spasming is because we've now introduced a brand new injury into a chronic area. The muscle spasm that you have, like back here, that's been there forever, and you've named it because you've had it over a year. You say, hey, this is old George or Henry or Pablo or Susan or whatever you want to call it. We get that muscle, we find that exact spot, put the needle right in there, move it around just a little bit. We don't have to go and jam it in and out and make hamburger out of it. That's not what we want to do. And we don't want it to cause bleeding on the outside. A little bleeding on the inside is normal. Sometimes you'll get a little bump or maybe even a little bruise. That's what we're actually looking for. As you create that little tiny hole, imagine this is going inside the muscles, right? This little needle goes in between the different muscles like this. And then when we twist them, it wraps them up, okay? Then we can move them around a little bit, and that agitates them, causes the nerve cells in the area to send information to the brain that says, hey, there's a brand new injury there. What do we do about this brand new injury? Release some heparin, release some histamine, release some enkephalins, release some other factors that will cause attraction of mediating factors which will help you heal faster. Macrophages to help clean up old debris. There'll be scar tissue in the area. They can actually start cleaning that up. Now, generally one visit can be enough to feel some kind of difference, but it's going to take time, just like it took time for you to get there. 5 visits to 9 visits is about the main kind of level that I use. We see good results in that case. I do have packages of 10, which you can use, but most people don't even get that far. We'll use the rest of them for kind of a maintenance care. Now, for me, I always use acupuncture along with it, which I call adjunct points. So I may use points far from the area to help calm down everything. Sometimes you can even feel them more. You feel that Tai Chi feel more if I can find the right points or get the right combination of points, making the muscle spasm release faster and release longer. What do you do after that treatment is go and use it like you normally would. You give at least 3 to 5 days between each treatment because we don't want to go too far out and have it completely go through this healing thing where it starts all over again and goes back to square one. But we don't want to go too fast and keep causing more and more bleeding and more inflammation, which just causes damage and buildup of more scar tissue. So there's a fine line between how often we need to do it between visits. Give us a call or text me at 720-325-9886. Look us up on thenaturalbodyworks.com and give me a call. Get in here for some dry needling. It's really good stuff. It doesn't hurt as much as you think. Everybody thinks it would hurt a lot because they see, if you look online too, you can see a lot of videos of people actually getting in there, moving the needle back and forth like this and twisting it around and doing all of these kind of crazy things, which isn't always necessary. Sometimes it is. But I try to avoid that. I want it to be as comfortable as possible because remember, this is the feel-good place. I want you to leave here feeling better than when you came in. So this is Dr. Sean from Natural Body Works signing off. You take care. Give me questions and stuff in the comments if you have them down below. Don't forget to sign up for subscription because you want to see these more, right? I'll try and do some videos. If you want to have a video done of you, of me doing dry needling on you, let me know. I'll put you on here and we'll put some needles in you and show everybody, and you can gross out and show everybody else how many needles you had in you and how deep they went. So I'll talk more about how deep and why and which directions of things later on. Just give us a call. Take care. Bye.